Madam Speaker, I'd like to ask unanimous consent that I yield to myself 3 minutes and then be allowed to yield the balance at that time to Chairman Stark to control.
Without objection, the gentleman from New York is recognized for 3 minutes.
Thank you, Madam Speaker. I stand in support of overriding the President's veto, not for the reasons given by Chairman Dingell, because it's the right and moral position, because that has existed all of the time, and yet we've been unsuccessful. But I would say to the gentleman from Texas that since the last time this has come up, the President has admitted that we are going toward a recession and that the economy may be jeopardized unless the Congress supported a stimulus package. It would just seem to me that if it's recognized that our states are going to go into deficit, our governors are going to have serious problems, and that it is very possible, if not likely, that services for our kids would be further cut under Medicaid, it would seem to me that a legitimate argument could be made that by providing care for these 11 million children, it allows their parents to know that they'll be able to be more productive knowing that their kids are covered by health insurance. It's sad that the poor now have to be used merely as a vehicle to stimulate our economy. But had we taken care of these people during the robust, great economic times, perhaps we would not going through this struggle. So it appears to me that this is another opportunity that the minority would have, not just to do the moral thing, but to do the economic thing, and to be of some assistance to the governors who are screaming out for the continuation of this program, indeed the expansion of it. And we're not talking about just adults being restricted, but we talk about adults being in a better chance to be productive knowing that their kids are being taken care of. So we do have this new opportunity for the minority to rethink their position and to do it again because it's the economic thing to do, and to know that being able to detect serious illnesses, sight problems, hearing problems for our children at an early age, that we really are strengthening the economy so we don't have to pay for these health setbacks and sometimes detection of chronic diseases at a later stage. So instead of talking compassion, which obviously is not a compelling argument on the other side, let's talk economically and ask the question of economists whether or not expanding preventive care for our children and health care is really strengthening the economy and saving money in the future with all the restrictions, you know, kicking illegal aliens out and making certain that adults don't participate. All of those things that make you feel good we go along with as we have in the past. But let's make certain that every child that can be treated would be treated, and so I support the override and yield the balance of my time to Chair.